Mrs. Binta Yem, made the disclosure in Kafanchan on Wednesday, at skills acquisition training organized for young girls. Incidence of HIV/AIDS is very high in Africa. They also provided HIV counseling and testing services to 21,015 youths in the area within the months under review. The coordinator, Local Action Committee on AIDS in the area, Mrs. Binta Yem, made the disclosure in Kafanchan on Wednesday, at skills acquisition training organized for young girls. NAN reports that the training program was part of activities organized to mark the 2017 World AIDS Day. Yem said 4,343 of the 21,015 youths were screened, out of which 24 were found to be positive and placed on treatment. She said the youths were reached under the Adolescent and Young Persons, APES, project, a UNICEF-supported program designed to scale up HIV combination of prevention, treatment and care services for APES in the state. She said the skill acquisition training was organized particularly to reach out to young girls who are lagging behind their male counterparts in HIV testing. According to her, only 1 or 2 out of every 10 APES tested in the local government area were girls. Most of the APES that were counseled and tested were boys with only a few girls among them. The reason is because the boys are easily accessible on football field and other social gathering, while the girls are usually at home. To celebrate the 2017 World AIDS Day, we decided to organize the skill acquisition training in beads making and make-up, among other skills as a strategy to bring the young girls out. It is such that while they are learning the skills, they will be counseled and tested for HIV, Yem said. One of the adolescent girls, Amai Shuaibo, could not hide her joy after being tested, describing the initiative as youth-friendly. I have never been tested before because it is usually done by elderly persons, but seeing that the counselors and testers are adolescents like me, I did not hesitate to offer myself to be tested. I really commend UNICEF and the Kaduna state government for this laudable initiative, she said. Abba Gideon, one of the HIV/AIDS service demand creators in the LGA, told NAN that only few adolescent girls offered themselves for testing. Gideon said the challenge was more among the Muslim communities they visited, saying that they always declined to be tested even after educating them about HIV and AIDS. The HIV and AIDS specialist, UNICEF Kaduna, Dr. Idris Baba, said the project was being implemented in 7 local government areas of Chicken, Igabi, Lear, Kagarko, Bernangweri, Jaba and Jema'a. He said that 624 demand creators, counselors and testers have been trained for the project. Also read, United to roll out generic of latest AIDS drug in Nigeria. He said that 468 are creating demand for HIV services, while 156 are providing HIV counseling and testing services in the 7 LGAs. This is because only a few of APES in the state know their HIV status, and the reason is simple: HIV services in our health facilities are not youth-friendly. The youths are not comfortable discussing HIV-related issues with elderly people.